want to welcome everybody to Newbridge Medical Center, and we are proud to provide this presentation, I have to say this twice, as part of National Alcohol and Drugs Facts Week. And what National Alcohol and Drugs Facts Week is, it kind of links students with professionals and other experts nationwide. And they want to, I guess the goal is clear. It's to counteract all of the misinformation that the kids get. Our teens are getting misinformation from, and they actually labeled it, social media, the internet, TV, movies, music, and of course they're getting misinformation from their peers. Like I learned early on working with adolescents that they actually are not better in algebra when they smoke marijuana. So these are the things that they think. It was launched in 2010 by scientists at the National Institute for Drug Abuse. And the goal was really to stimulate these educational events, in the community. This week, community and school events are taking place throughout America. To that end, we have assembled a panel to bring teens and experts together to learn the facts about how drugs affect the brain, the body, and behavior. And at this time, pressure is on. It is my pleasure, my honor, to introduce our president and CEO, Deb Visconti. Deb, before you begin, I want to thank Deb because it was really because of her support. Kind of like we didn't have a lot of planning time that we were able to put this event together. And I want to brag about Deb because I do all the time, and I like my job. To say that Deb is a visionary, honestly, would be an understatement. Deb's leadership, Deb's innovative ideas, always thinking outside the box. And this is unique. A CEO's understanding of the needs of people with addictions has really led to the rapid growth of the expansion of treatment services we provide for people with addictions in Bergen County. With that, I'd like to introduce Deb Visconti.
Thank you, Mike. Wow, now I have to live up to that introduction. But thank you, and really the thanks go to Mike and Donna Lee and the team that put this together in very quick order. It is a vision of mine to be able to open up these venues for the community and to be able to share our resources and our expertise and bring all of you together in these types of forums. So thank you, Mike, for pulling this together. For those of you who are not familiar with Newbridge Medical Center, I just thought I'd take a step back and introduce you to us. CarePlus Bergen is a partnership between Rutgers Medical School, CarePlus NJ, and Integrity House. CarePlus Bergen was awarded the management of the county's hospital, and I might add, the largest hospital in the state of New Jersey. And we named the hospital, it used to be called Bergen Regional Medical Center. It is now called Newbridge Medical Center. And we are just about 4 months old. We took over operations on October 1st. So this is a new day dawning for Newbridge, for us, for our communities, and for our staff. We are committed to partnering with our communities to identify the needs that you have and bridging those gaps and being able to provide venues such as this. As Mike said, today begins National Drug and Alcohol Facts Week. We acknowledge that early education is key to stopping the rising numbers of substance abuse disorders. It is burdened upon us as providers to use and emphasize our educational resources to teach teens and parents alike about the risks involved with drug and alcohol use. Tonight's presentation is the first of a series of programs created through collaborative efforts to address the needs of those with addictions. As I said earlier, this is the first of many that we plan to host here at Newbridge Medical Center. We are dedicated to this mission as evidenced by our support of the Addiction Services line. Addiction is now a separate service line under Newbridge Medical Center with dedicated leadership in Mike Palello, our Chief Clinical Officer. It's important to know that our addiction programs has and will continue to play a vital role in very important Bergen County initiatives. We are active participants in Helping Hand and Heart Operation and Heart programs. Many of you know about those programs. Operation Helping Hand is considered an innovative and collaborative law enforcement and public health initiative targeting the heroin and opioid crises in Bergen County. And HEART, which stands for the Heroin Addiction Recovery Team, is a program launched in various Bergen County municipalities in which those seeking recovery are able to turn themselves in to the police and be connected with services here at Newbridge Medical Center. So we stand proud in support of those programs. These examples, along with events such as tonight, bring us together in one room, a wealth of resources. And when I look around at how many people are here, you've given up your Tuesday evening. I know it's a rainy evening, so there's not much to do, so this is a great way to spend it. But you're all here together because we're all in it together for the cause. Again, I'd like to thank Michael and our panelists for being here, all the agencies that are represented, and all those that are instrumental in planning this event. And again, I welcome you to Newbridge Medical Center, and I'm sure this is the beginning of a long and a vibrant journey together. Thank you. How did you, Mike? You still proud?
So proud. I just want to say, we are Newbridge Medical Center. You have to put $1 in a pot every time you say Bergen Regional Medical Center. I have no clue what Bergen Pines would cost. Anyhow, so next I want to introduce Sue Deviak. Sue is the Director of the Division of Addiction Services at the Bergen County Department of Health Services. In this role, Sue directly oversees all Bergen County operated programs. Sue has worked in the field of addictions for over 27 years. Started very young. Sue began her career as a substance abuse clinician at Hackensack University Medical Center. Shortly thereafter, Sue implemented and eventually became the administrator of the Outpatient Adolescent Substance Abuse Services. In 2002, she became the executive director of Bergen County Spring House, which is a halfway house for women, where she developed an innovative, comprehensive clinical program to address the unique needs of women in recovery. Now, I will say, Sue and I work on a lot of initiatives together, a lot of committees we sit on, some debate and arguments there, but I always tell Sue, and Sue knows this, and I always brag about Spring House. It's just an amazing program. They have, it's almost unbelievable, a 98% success rate in terms of graduation. And it's not a 2-week program. It's, Sue, how long?
9 months.
9 months. 9 months
Average.
and a 9-month average and a 98% graduation rate. That's just great. So with that, please help me welcome our Director of Division of Addiction Services here in Bergen County, Sue Deviak.
Don't do that. Good evening. Thank you all for coming. It's so important that we see a community that's involved, especially in addiction services. It's so hard to provide these services to people with addictions because of the stigma attached and the lack of understanding of a community of exactly what it is that's going on with people who have substance use disorder, substance abuse disorder, and mental health issues. So the stigma-free community that we are working on putting together and are very successful with is a very important piece of this. I'd like to thank Newbridge Medical Center and for asking me to speak to you this evening about the services that we offer with Bergen County. It's very, it seems like an unknown thing that Bergen County residents can get services that start with detox, short-term rehab, outpatient, and halfway house level of care for free if you're a Bergen County resident. That's something that not a lot of people know, and we've been doing it for years. So we have partnered since October with Newbridge Medical Center and with the help of Michael to get people in the door for detox as quickly as possible. And that has been working tremendously well between the resources here at Newbridge and the resources that we have through our grant dollars, etc. We're able to put people through a very seamless continuum of care, which means I can put someone from detox into short-term rehab, and then from there to either outpatient or halfway house level of care. We've been working, Spring House has been here for quite a number of years, but the last 15 years or so, we have done a really excellent job of bringing these women around. Women are very unique in recovery. They have a lot of other issues going on besides just using the drug. There's a lot of trauma that goes on in their lives, and we tailored our program accordingly. The state calls us a treatment halfway house. I like that, because that's exactly what they're getting. And the other part of our programs is the prevention piece. The Governor's Council offers us funding to do prevention, and we give that funding to the various municipal alliances to bring the messages of prevention into the communities. So with that, we have done things, we have worked with Helping Hand, we have also worked with the recovery assistants. I'm sorry, I call them recovery assistants, but the recovering coaches. And I also have prescription drug drop boxes. We have a lot of prevention dollars and ability to bring prevention to the community. And we're looking forward to collaborating with Newbridge to bring that message now, especially for young people, because there's a lot that happens. I don't know if any of you have been aware of the newest thing that's out there, which is eating Tide Pods.
I heard that, I don't get it.
It just completely blows my mind. But that's what happens. In all these years of working in this field, I've always been blown away by the next crazy thing. It's kind of like, they're drinking cough medicine, you know, why? But that's exactly what happens. They find something and they go with it. So we have to kind of be 10 steps ahead of our young people and see where they're going before they get there. So I would like to just mention that the county of Bergen has for a very long time supported addiction services. Our freeholders, our county executive are very, very proactive with giving us what we need, and our county executive has been front and center with getting this hospital to where he'd like it to be, and so we are just pleased to be able to have the opportunity to work with you and to bring whatever we can to the community in the area of treatment and prevention services. So thank you.
Big emphasis. I will say, just by nature of us being a station net hospital and having the large treatment services that we do, I've pretty much dealt with all 21 counties since I've been at Newbridge. I'm not going to say what we used to be, Newbridge Hospital Medical Center. And in dealing with the counties, there is no other county that has the addiction services county run. I mean, the county operates not only one of the best treatment centers around, just the fact that the county is involved in the operation of treatment is unique just to Bergen County.